Welcome to The Spark, Medical Education for Curious Minds. We present the stories behind the people at UCSF and get to know the human behind the professional. I'm Chloe Salas, a student in the School of Medicine.
And I'm Paul Branfenbrenner. This season, we're sparking a new conversation across UCSF. Where do you find joy, meaning, or purpose in your work? And so, Chloe, can you please tell our listeners who our next guest is?
Our guest this week is Dr. Lorriana Leard. She's widely known as a pulmonologist specializing in the care of patients who have lung cancer or advanced lung disease, but she and I actually met in the context of her becoming my coach in the CMC program here at UCSF.
Yeah, and so our listeners have had the chance to listen to my interview with Peter, who is my CMC coach. That's episode 5. If you haven't listened to that yet, make sure to give that a listen. So can you tell us a little bit about your experiences with your coach, with Lori?
Lori really welcomed my CMC group to UCSF with open arms. I think the first time we met was over Zoom, but as we got to know each other in person, we would go out to meals together, we would just hang out and chat about things both related to medicine and outside of medicine. And tonight, actually, after we record these intros, Dr. Leard and my entire CMC group are going to go get banh mi sandwiches for dinner together and just catch up.
Oh, that's so fun. Yeah, and it highlights what CMC is about. Not only is it kind of learning clinical skills and these QI projects, but it's also just community, a kind of a way to build that camaraderie and support system throughout UCSF.
Absolutely. I feel like our CMC groups are one of our first sort of people to touch base with after a long, hard day, in the clinic or on the wards. They're just, our family here.
Yeah, and I'm so excited for everyone to listen to this episode because there's an exciting career announcement in store, kind of breaking some news on the Spark podcast. So without further ado, here is our interview with Dr. Lori Leard.
To all of our listeners, let me set the scene. We're on the 13th floor of Parnassus Hospital. Inside of Lori's office, we're overlooking a view of the San Francisco Bay, the Golden Gate Park, and even the Golden Gate Bridge, which is beautiful. And we're inside Lori's office right now. And the first thing I saw was a picture of our CMC group near the holiday season at Lori's house, dressed up as characters from Scooby-Doo, because why not? And that just is a way of introducing our CMC group and basically the head of our group, who is our coach, Dr. Lorriana Leard. Thank you so much for coming on, Lori.
Thank you. It's such a treat to be on with you.
Thank you. So Paul and I have talked extensively about the CMC coaching program, what it means to the students, what it means to our coaches. But I was wondering, in your own words, how would you describe, that first meeting that we all had together on Zoom a year and a half ago?
Wow. So I think for me, being a coach, and I guess having the opportunity to interact with students who are embarking on their careers has been really one of the highlights for me. I think what we have the privilege of doing as in our careers, it involves such a trajectory and a journey that being able to be a coach and be part of that journey with other people is just such a special. It's been such a special part of my life for the past 6 years, and seeing the newness of medicine through learners' eyes and having that opportunity in some ways for me to kind of go back to medical school has been a delight.
It's so much fun too, because we get to check in with the same group of people every week. We get to see how all of us are growing and provide feedback to each other, receive feedback, and that helps us grow a lot. And then you also see us grow over the 4 years, and I'm sure you've seen that a lot with your past CMC groups.
Yeah, no, it's that period of growth coming in from being a college student or whatever people have done before they start medical school, and introduction to patients, introduction to how do you think about your own role, how do you think about your own career, how do you grasp the uncertainty of medicine, and how do you embrace that and grapple with so many challenges that come about as you're just starting the journey as a medical student. And that doesn't even mention all the other outside challenges that one might be confronted with. So having a small group of people to go to make that journey together, to bounce ideas off each other, to share frustrations, share challenges, and find common strategies, and then have a safe or brave place to be able to try new things, to practice some of the newer skills that you have, and then have a group of people who can give you that real feedback and help you reflect. I think learning how to reflect, something that is newer to even to me in my careers, reflecting on what you've done and really being conscious about that reflection and thinking about, how can I use the experiences that I've had to be a better person, a better clinician, but also, better in terms of my interactions and communications with all people, really.
One thing I've noticed more and more about medicine is that you're continuously learning every single day. There's something new, there's something updated, there's a way to become a better physician. And we often call this in medicine as like continuing medical education. And Lori, just today, you shared some very exciting news with me. I was wondering if you'd like to share it with our listeners as well.
Yes. So, my career has taken different turns, but my latest is that I'm going to be the Associate Dean for Continuing Medical Education here at UCSF. And so I'm really thrilled with the new opportunities and challenges that may provide for me, especially for me, because part of the reason I am so passionate about academic medicine is helping the entire career trajectory. As we think about our entire careers in medicine, how do we stay really up to date with not only just the knowledge, medical knowledge, but how do we really stay trained in our communication skills, in really making sure that we're meeting our patients and supporting our patients where they are. And so how can UCSF, once you finish your training here at UCSF as a medical student or resident or fellow, how can UCSF continue for the rest of your career, which oftentimes is a much longer period than your period here of training, and continue to help you to be the best possible physician that you can be for the rest of your life? And how do you find ways to stay up to date, things are changing so much in so many ways, and stay networked with people, and so I'm very excited about this new challenge, this new way of expanding the education that we provide to our community and even potentially globally.
Yeah, and I think it's so cool that you use that phrase, like up to date. For our listeners who are not in the medical field, up to date is also the name of one of the electronic tools that clinicians will use to look up patient symptoms, to check on what the correct dosing might be for a medication, and definitely a tool that we medical students are using day in, day out. And I think it just goes to show that no matter what stage you are in your career in medicine, there's always something to stay updated on. And I'm curious, Lori, as you look into the future of continuing medical education, or CME, what do you think are some of the biggest things that we'll have to learn or be challenged by in the future of medicine?
Well, I guess the latest one is ChatGPT, right? I would be remiss if I didn't mention that. Or Bard. There's going to be other AI challenges, but I think what you just pointed out, that medical knowledge is highly accessible to a lot of people these days, right? It's accessible to our patients, it's accessible to us, but how do we filter that abundance of information and then translate that into really the ideal and optimal patient care, and really continue to have very patient-focused attention that's individualized, that's there's more to medicine than just the knowledge piece. And so I think the challenge for continuing medical education in the future is making sure that we're continuing to hone in our skills on that here at UCSF, we really firmly believe is more than just the medical knowledge piece, right? How do we make sure that we're being sensitive to the needs of our patients, the cultural backgrounds, the different pieces, and filtering in when a patient comes in with this knowledge that they've obtained from their, from the internet or from whatever resources they have. And how do we continue to address their most pressing concerns? How do we continue to acknowledge the things that they're most worried about, or they've read about, or they've heard about, and take that into context, and make sure that we provide them with the best care possible.
And that's one thing that I think, Lori, you taught our CMC group early on is some of our listeners will remember that we've talked extensively about the CAMBAR Center and pretending to be, creating those simulations where we are, as medical students, acting as doctors, and we have people acting as standardized patients. And from day one, Lori always taught us, one of the most important questions you can ask is, what about this most concerns you? Or do you know anyone who has similar symptoms to you? Because often you unveil this story where, oh, yeah, I had a friend of a friend who they just thought it was a cough, but it turned out to be like a spinal fluid leak, or, my mom had this and I'm really worried that this could be happening to me too. And it's something that you don't get unless you ask the right questions. And patients often won't reveal it unless you know to ask. So I really appreciate that comment on people coming in with their own concerns. They probably Googled something that astonished them, and Google is meant to be, astonishing in that way, to pull up the number one hit result. And then I also loved your comment about ChatGPT. I'm really curious what your thoughts are about how that might play into medicine in the future.
I think right now we're only scratching the surface. I think in all fields it's going to be really an interesting challenge to see accessing, I think, information will become a lot easier. But as we've even seen in the last many years, that having access to the knowledge doesn't make us better providers. But critical thinking. How do we think critically? How do we do our clinical reasoning? How do we utilize what we have in the most effective way? So that's where it's going to be, take additional skills in terms of learning from and how do we filter through all that information, right? What we've seen in the last couple of years is how do you establish what's misinformation?
Yes.
And I don't know that AI is going to be able to do that, to filter through and identify what is the primary source for this? What kind of research has actually been done, and how do you filter through the medical research that's being done and most up to date, and taking the latest research and then translating that to the best patient care. And so I think that's where it's going to take more of those skills at integrating. We as human beings, it will be interesting to see how much AI can help us. But the emotional piece, I think, as you as medical students learn in medical school, there is such a piece that's your emotions, the patient's families, and that addressing those and incorporating that into your daily practice. And how do you do that, acknowledging the added layers that I don't think that or something that AI is going to be able to achieve. I mean, technology has been amazing, right? Technology has enabled us to have Zoom classes or, meetups and things like that. So we've had a great integration of technology, and so I think the next challenge will also be, how do we embrace this technology? We're doing, we use robots for bronchoscopy now. We do, we have electromagnetic navigation for finding certain lesions in bronchoscopy. So there's definitely advantages to having technology that we can utilize to optimize the care that we're using, for patients. So I think there probably will be some way that that AI will further our ability to care for patients. But I think it's walking that. What's the best way to integrate it, and again, always being kind of patient facing.
Right. And for our listeners out there, just so you know, Lori came and met me after performing a bronchoscopy. Did that happen to use any sort of robotic or AI assistance today?
It's still fiber optic bronchoscopy, or with a video, right? Video. So this was our standard bronchoscopy. Yeah.
Yeah, but it's so incredible how quickly the technology can change. That's something that I'm really looking forward to seeing in the next few years as I continue on my medical journey. So we've talked a lot about the future of medicine, and it's made me curious about your own path in getting to medical school, deciding to become a coach. Like, where did it all start? Like, when did you know that you wanted to go on this path?
I came from a background of loving learning. I was one of those kids that always loved school, and I had volunteered for my dad when he, his dad's work. He worked doing diagnostic equipment for cars, but I knew I didn't want to have the kind of routine job where I did the same thing every day. I think that was really what was driving me, is I was passionate about having interactions with different people on many different days, and having no 2 days that were pretty much the same. I think the turning point for me, I should say, I was nobody in my family that did anything in the health profession, right? Not any kind of health profession at all, not even a dentist, not a veterinarian, nothing even close to health professions. But I had a high school teacher my senior year. I'd already decided where I was going to college, but who offered for the first time a physiology class. And it was a small class with about 8 students. And it just opened up the window to like thinking about physiology. And I was so intrigued. And I think it led the stage for me to change directions. And so in college, really studying, I focused on human biology and became really excited about human biology. I was lucky enough to have an interdisciplinary major. So there was a focus on psychology and public policy and ethics and really have that as a foundation in thinking about the human and going from there. And so I got to be a course assistant for my last year in college, and that continued to fuel my interest in going into medicine. And so from there, I grew up in California, but I thought I was going to leave California. I went to medical school in the state, but as far away from San Jose as I could get. So that was UC San Diego. And after that, I left the state for residency thinking I would never come back. But I came back to UCSF for my fellowship because I still to this day think UCSF has the best pulmonary critical care training program in the world. And so really glad to be here and to have gone through many different twists and turns and changes in my a career to the current day.
Yeah, that's amazing. I really liked that your major offered the ability to study not only biology and the science, but also, as you mentioned, policy, psychology. I think human biology rarely exists in a vacuum, and that's something that we're often taught at UCSF. And when it comes to patients rarely exist in a vacuum. So I think it's important that our education reflect the real life possibilities of what a patient might be experiencing, which is really cool. How did you know, you've answered this for our CMC group, for our listeners, how did you know that you want to do pulmonary care?
Really, I think it goes back to me wanting to do something different every day and finding a specialty that gave me that ability. So I chose to go through internal medicine because I've always loved the I've told you this, I know, Chloe, but I've always loved the mystery of taking all the clues and finding the diagnosis and working, so I think that piece of internal medicine really intrigued me, that you would take the clues that the patient gave during their history, the clues that you would find on your physical exam, any additional diagnostic, laboratory or imaging studies that you would have, and really try to synthesize those together to really think about what is the most likely diagnosis, what is the, and what additional tests do I need. Growing up, those are the kind of books I always liked to read. It was the mysteries. Can I get the right answer? So that's what led me to internal medicine, and then thinking through a procedural specialty. I really am glad that I chose pulmonary medicine. Part of the reason I chose to go into pulmonary medicine was because there were still so many unanswered questions. And I think there still are. We still are so many different areas where we need to do more research. We need to find better cures and better ways of caring for our patients. Lung cancer for me was one area where we really had not made much improvements. Now in the last 10 years, there have been lots of opportunities to make better. We're better at diagnosis. We're better at management. So there's lots of areas that were of interest to me. And then I do like the procedures. So as a pulmonologist primarily, I do a lot of bronchoscopy procedures. We do pleural procedures. We get to do in the ICU. I think the different opportunities to do intubations and other things with your hands. So my career now, one day I'll do bronchoscopy. One day I'll see patients in the ambulatory clinic and see patients that some of the patients that I've been taking care of now for over 15 years, and then I'll see patients in the ICU that are on ECMO that are very sick and need a lung transplant. And so it gives it's what I've always wanted in the way that I have this variety. And I work with an amazing interprofessional team. And I think the ability to work and care for patients and try to advance the care for all patients, as well as, really focusing on advancing the care that we provide and the provider experience as well, has been I probably could have gotten here a different direction. I probably could have chosen a different specialty, and I would be equally happy.
Yeah.
But for me, and right now, I really find a lot of joy being in the specialty that I've chosen, and with the people that I have the chance to work with every day.
I'm so glad that you used that word joy, because listeners, I did not tell Lori to use the word joy at all, but that actually segues perfectly into the theme for this season. Where do you find joy, meaning, or purpose in your work, either in medicine or outside of medicine? And it sounds like a lot of it comes from the fact that you get to interface with so many people, that you get to do hands-on work as well as intellectual work, putting all those clues together. It's like a perfect mix of everything that you wanted growing up as a kid, like looking at diagnostic stuff with your dad in the cars and then reading mystery books and stuff like that.
I really think that's probably exactly right. It's the joy of working with people, and having that opportunity to, some of the people that have been on my lung transplant team with me that we work together, some of the pharmacists, some of the nurses, some of the other physicians, providers, we've worked together now for 15, plus I guess I've been here longer than that now. So so working with the same group of people, plus adding new people to our team, and having some of the, really have the best outcomes in the country with what we're doing.
Yeah.
The fact that we can have, especially thinking of our lung transplant patients, we take some of the patients that are really, really at the really, really advanced stages of lung disease. And so we really have that group of patients who are suffering, I think, in some degree, or contemplating the ends of their lives, and then being able to work together as a team to help those patients to essentially get a new life. And it's different. It's not. They are. I wish I could make it that they didn't need to take all the medications that they need to take afterwards, or the CS as often as they need to seek medical care. But the fact that we have this ability to continue to care for them and through many obstacles and challenges in their life, and really give them at least a chance for life again without oxygen, and opportunities to sometimes see different stages of their family's life, to be present in the lives of their loved ones, and that we get to know them over time. So it's really, I am so honored and so lucky to get to do what I do, and to have the opportunity to interact with these patients sometimes for a short time and sometimes for a really long time. And so I in some ways get to live vicariously through them as they get to, share some of the joys of their life. So it's the people, it's the patients, it's the, working with the same wonderful pharmacists who are so dedicated to what they do, that they make me a better physician by working with the other members of our team. I think that's what gives me joy every day.
And I think it's so telling that the division department is called pulmonary and critical care. And like, I as a medical student don't really know what critical means in medical terms, but when I hear it as a layperson, I think this is a time in the patient's life where things are critical. They're reaching a point in their lives where they're considering what is most important to them, what matters. And I think that was also reflected in the CMC project that some of your CMC group members did, including myself, where we would ask patients, have you considered, what is important to you at this point in your life? Because a lot of these patients are really ill and they want to have a say in what might happen to them in the event that they can't make their own medical decisions. And a lot of our conversations with patients just focused on, I want my family to not be burdened by making a choice that they think would clash with whatever choice I would make. It's a lot of conversations too. I wish medical school had a philosophy class. I feel like that would really benefit us in terms of thinking about how patients want to be taken care of. Just to wrap up here, I know, Lori, you and I have had some discussions about, life outside of medicine, being a woman in medicine. And I'm wondering, in case you might have any insights into that or anything just generally you'd like to share with our listeners.
One thing I always knew is that I always wanted to be a parent. That was something that was important to me. And so I think the advice I would have in terms of thinking about this is remembering what your priorities are, and remembering that if you are thoughtful about it, there's always ways to be able to prioritize the things that are important to you. So for me, it was finding a career that I loved and was passionate about, because it makes it so easy for me to do both. Because I feel like I can be present in both locations. I can be a good mother I can be a good physician, and I have time to focus and flexibility to focus on both of those areas. And I think if I didn't love both of them as much, it would be a lot harder. So because what I'm doing, I'm always doing, I guess I'm unfortunate. I feel like I'm almost always doing something that I love, right? It doesn't always feel that would be lying to say that I'm always doing something that I love. But I have, and one of my friends a long time ago when I was first becoming a mother said to me, gave me some good advice, which is I think I'm a better mother because I work in some ways. And I love what I do. So I feel like I hopefully my daughters will say that I was a good role model for them. Hopefully the people that I work with at work also think that I'm a good role model for doing those things and recognize you can't do everything all at once. Everything all the time, all at once. I'm somebody who calendars very well, and I sketch out my life. I make priorities based on what's on my calendar, and seem to be able to find a way to do it, but I don't have to. While I'm at work, I'm allowed to think about my daughters. When I'm at home, my daughters know that I sometimes have to work. So it's and not, I think, recognizing that they're all different parts of who I am, and they all are a part of me.
And just one last question here for you, Lori, because I'm staring at that picture of us as a CMC group dressed as Scooby-Doo characters. What has been your favorite CMC group shenanigan from the last year?
From the last year.
From the last year. I will say our CMC group in particular pulls a lot of shenanigans.
I will say, so at the end of the first year, as we were kind of providing closure, our end of the year assignment that was kind of given us at the somewhat last minute was to present a case, I think, or summarize and do an oral presentation, I think was the assignment. And you and your fellow students put together the most interesting oral presentations, essentially roasting each other and me, and but in such a creative way. And so I think I'm blown away by the creativity that's brought to work every day. Again, so individualized creativity, and yet your particular group, how well students can work together and make and create and make something that's really really amazing and thoughtful, but yet still using the principles of what you were taught, right?
Yeah. It's very true. For example, our CMC group teases me all the time because I use hand lotions very, quite religiously. And so as a result, when we were coming up with like a quote unquote patient to present, each one of us was a patient, and they're like, CS is a 25-year-old female presenting with chronic soft hands due to lotion overuse, which is a very medical way of saying she uses a lot of hand lotion. We try to mix learning with fun as much as we can, and I find it very effective. So yeah, and Lori, as our coach, you've tolerated it and encouraged it, and it's just made such a fun learning environment. So thank you so much.
Thank you. And I guess the other, I think if I would add would be, expect your career over time to take different trajectories, and that my career has changed over the years from being more involved in graduate medical education, like the fellowship and the residency, and then I've had the opportunity to be involved more in undergraduate medical education, and now transitioning to continuing medical education. So not only is every day different, but different phases in your career can be different. So as you seek joy in your life, recognizing and reflecting on what you've done and where new areas for growth might be, I think that's always it also brings you, if you, again, for me, changing it up a little bit and finding new ways to grow and develop and always be learning.
Yeah, exactly. Always be learning. This is a lifelong job, and you're always going to be learning something new. Well, thank you so much, Lori, and we wish you the most luck, and congratulations again on your new title and your new position.
Thank you.
So exciting.
Wow, what another great interview that was, Chloe. What were some of your major takeaways from your conversation with Lori?
I think overall, when I look back, I'm just thinking about the evolution of medical education. It's so different now from the way it was hundreds of years ago, not only in how medicine is taught, but also the content of medical lectures and the way that we teach. For example, a couple of decades ago, we didn't have all of these details about the biologic or cellular mechanisms of certain diseases, and now we do. And so that's something we incorporate into our curriculum. A few decades ago, we didn't know how much of a role technology would play in education in the hospital, and now it's sort of integral to a lot of the things that we do with the electronic medical record or even in classrooms. So I think my big takeaway is that medical education has always been evolving, and it's not really something to be afraid of.
Yeah, I totally agree. I think your conversation about ChatGPT was also really interesting. And I was just having coffee with one of my mentors, and actually it came up as well. We were talking about it a little bit because he was talking with this interprofessional group about the future of medicine as well and the role of AI and something like ChatGPT in medicine. And his takeaway was actually generally very positive. He was very excited for kind of what lies ahead with that, because in his mind, ChatGPT and those kind of automated interfaces allow for you, the clinician, to have more time to be with the patient and focus on that, and less time either charting or kind of doing these tasks that might be just very time consuming that can be automated in a safe place like that. What were some of your views on AI and ChatGPT in medicine?
I frankly think that it's changed a lot even over the past few months. I think when I first came into medical school, I would ask certain specialists what they thought of AI, quote unquote, taking over their jobs. For example, would AI be able to read a chest radiograph? Would AI be able to identify a cancerous mole? Things like that. And clinicians have a lot of different things to say, but I think what I've come to is it helps a lot and it saves a lot of time. For example, when I was on my inpatient medicine rotation and I was reading EKGs, which are readings of your heartbeat, I kind of thought to myself, wow, how much more time would it have taken to count out the individual beats on these little grids, or to count the milliseconds of the PR interval or the QRS interval, if it wasn't automatically calculated by the machine and displayed on the top of the paper? How much time is being saved? How much effort is being saved? How those things can be redirected into patient care.
Yeah, I think there's all these advances in imaging and a lot of things that are taking physicians and clinicians away from the patient, and kind of rounds happen mostly on computers. A lot of the 20th or 21st century physician, the image is a person sitting at a computer while a patient is kind of looking at them, expecting more of that those relationships. And I think automating some of these things in ChatGPT could allow for the physician to go back to what kind of their original role was, which is taking care of a person and being present with them. I think that's pretty exciting. Although as a medical student, my experience with ChatGPT so far has just been sitting in lecture. So right now we're doing our immunology unit, and I would be looking to some classmates to next to me, and we're a few weeks into immunology, so we're kind of past the basics. And ChatGPT is really good at, you can type in like generic questions and it'll give you like a basic readout of kind of an overview of some field. And I'll look over and they're typing in, what is T cell, or what macrophage do? And that is very helpful, but I think, there's more potential than just that too.
Agreed.
Well, with that, thank you again for this great interview, Chloe, and thank you to our listeners for listening to this episode. We're getting close to the end of this season, and we're so excited for the episodes ahead. So make sure to stay tuned for our next episode of The Spark.